Hello and happy Earth Day to everyone. My name is Lindsay Martin and I'm part of the Neocon team, and I want to welcome you and thank you for joining us for our programming series on designing well. First, I'm going to go over a couple housekeeping items. Today's sessions qualify for accreditation and certificates will be emailed within 3 business days to everyone who stays on for the full session. More details on accreditation can be found on the Neocon website under programming. Also, the final 15 minutes of this session will be questions and answers, so please feel free to submit any questions via the Q&A tab. And make sure you put those questions in the Q&A tab and not the chat box so we can get them queued up for our speakers. Also, any of the resources that our speakers are referring to during their presentation, if there's a link to them, they will be dropped into the chat box so you can find them there. So let's get started with a little background on our speakers. Our first presenter is Dr. Whitney Austin Gray, and she is the Senior Vice President at the International Well Building Institute, where she leads research that supports best practices in building design and operations, community development, and organizational policies that can contribute to improved public health for everyone, everywhere. She led the development of the first Well AP exam, Well faculty program, and the first case studies focused on the efficacy of the well building standard, helping to launch more than 100 educational sessions related to well in over 25 countries. Her lectures, webcasts, trainings, and published works have touched tens of thousands of design and health professionals worldwide, building a strong infrastructure of support for those who work to advance better buildings, vibrant communities, and stronger organizations. Next is Dr. Angela Lowder. In her role with IWBI, Dr. Lowder is responsible for identifying, directing, and managing evidence-based research that supports the well building standard. Key projects include co-leading the development of the global research agenda on health, well-being, and the built environment with the International IWBI Research Advisory, management of the pre-approved survey provider program for all well-certified projects, and creation of the IWBI country briefs using IHME global burden of disease data. As a research scientist, strategic planner, and educator, Dr. Lowder brings over a decade of experience in interdisciplinary research and partnerships around occupant health, well-being, and the built and natural environment. Our final speaker is Dr. Susan Chung. She is Vice President of Research and Knowledge at ASID, where she connects design with research to improve human experiences in the interior environment, translates research into applicable design implications, and conducts research projects that create meaningful positive impact. Dr. Chung integrated interior design with behavioral research for her doctorate degree in human behavior and design at Cornell University, with a focus on design attributes related to creativity and workplace environments. She has been a visiting scholar at Cornell for the past 3 summers, teaching an interdisciplinary course introducing how design is in all our surroundings and empowering students as to how they can use design to make a difference in our world. Now I'm going to turn the screen over to our presenters to discuss the role of research on climate change, human health, and the built environment.
Well, hello, everyone, and welcome. This is Whitney Austin Gray, and it's so much fun watching everyone join our virtual room. So if you're in front of your computer, if you have a chance, do give us a shout out of where you are dialing in from. It's always fun in the virtual world to know where our colleagues are joining from. And I can speak for my other friends and colleagues on the line today. Do search us out on LinkedIn. We're just so excited to continue the connection because we're going to talk about research today, and we really are focused on how designers play a critical role on research on climate change, human health, and the built environment. So we're so glad to have you, and it's fun to see some familiar names in the audience. So why is research so critical now for designers? So we really believe deeply that designers are positioned to move into client roles as trusted advisors during this time. In fact, now more than ever. To advise their clients on the health of the occupants, both their physical and psychological safety in returning to the space, and also really being able to communicate about risk management and mitigation issues. Designers have an impact on climate change. We're going to talk very deeply about how designers really are public health advocates very much in this space at communicating and translating the research into action, both on the micro scale and on the macro scale. So today we're going to be providing a series of tools and resources because we're researchers and we love resources, and you're designers and you love resources. So we are jam-packed full of links today and follow-up and downloads because we want you to get involved. We want to hear from you, and it's time to seriously activate this agenda. And so we'll be sharing with you the global research agenda today. We'll be talking about key research questions that we really are encouraging our community to dig into, specifically on the topic of climate change, human health, and the built environment. We're going to talk about some opportunities and tools to get involved in this work.
Thank you, Whitney.
So with that, I want to turn it over to Dr. Lowder to talk about a very exciting report, which is our global research agenda.
Thank you, Whitney. So we're delighted to be able to present this to you. We came out with this in January of this year. This was an 18-month process with 20 global research advisors. We instituted that in 2019. They come from all over the world, and in order to become involved, they had to have both expertise in 2 or more areas, as well as experience translating research to practice. At IWBI, we really are nested right between the research side and the practice side, and so we're constantly translating that evidence. And the goals of this research agenda are really to identify the key gaps, barriers, and sector-specific needs for research on health, well-being, and the built environment. We knew that we're doing well, but we could do even better. What would it take to have healthy building practices become the mainstream? As a part of that process, we prioritized 12 impact topics that we all felt would catalyze funding, research, and implementation of healthy building practices. It's not that there aren't other practices that are important, it's just that these ones really have the potential to really catalyze things forward. So this is a list of the 2019-2020 research advisors that were involved in co-creating this document, many of whom, in fact, the majority of whom have signed on for another term, so are helping us to activate this. And you can see here that we have a variety of people from the US and worldwide. So I want to be clear here, the global research agenda presents the current state of knowledge on health, well-being, and buildings. It's not a systematic literature review, but rather a result of the expertise and experience of our research advisors and our research team in saying, where are we now? What's the top state of knowledge, and where do we need to go from here? And the real key component of this is unifying multiple disciplines under the building health conceptual model, which we'll show in just a moment, really moving from or to and. So instead of studying climate change or human health, how does climate change link to human health? What about disease prevention and health promotion? Infectious disease and chronic disease. Traditionally, we know that these divisions have been split up. So you've got people studying air quality, also physical activity. We know they're connected, and yet they're not talking to one another. And really, to have a holistic approach to the building, we really need to have this integrated approach. So this really is exemplified by our building health conceptual model. We worked really hard on co-creating this with our advisors. And I want to note some key components here that I think would be interesting to designers. The first is that this looks at both environmental conditions as well as organizational outputs or inputs. So it's not just the environment, the indoor environmental air quality, it's not just the management policies, it's both. It also looks at individual and collective health and performance outcomes. A lot of these models tended to be a risk reduction model, and it tended to focus only on the individual. And what we're seeing and what we heard from our advisors is that we really need to take into account, especially with COVID, what is that collective experience of the workplace? How does that workplace culture impact health, well-being, and performance? We have mediating factors and moderating factors, and we also put economic inputs, of course, and for this group, design, policy, and planning decisions that lead to those environmental conditions that impact health and well-being. So this is a list of our 12 impact topics. So climate change, you'll see, is our first one that we've activated in our first quarter. We have access to nature, materials, technology, air quality, acoustics, equity and inclusivity, infectious respiratory disease, added as COVID hit, performance, thriving and creativity, movement and physical activity, and stress. We will be activating all of these impact topics, but for this year, for 2021, we've committed to activating at least 4, and those are the ones in pink. So we've just activated climate change, and Whitney's going to be talking about our recent webcasts and some of the results of that brief. Our Q2 upcoming, so stay tuned, is on stress. Not for nothing, we chose stress given the mental health issue and crisis we're having around right now with COVID-19 and return to work. Equity inclusivity is our Q3 impact topic, and then Q4 is access to nature. We will be activating the rest of the impact topics, but this is the minimum that we're going to be coming out with webcasts and an impact topic brief. Now, some of the key questions really that we are asking in the Global Research Agenda really for you is, how can the Global Research Agenda be used as a tool by different sectors, specifically today, the design sector? How can we embed the Global Research Agenda into local policies, research, and initiatives? What messaging may need to be adjusted for your audiences? This could be by sector, this could be by population, by region. What will success look like after 1 year? So if you decide to activate and we work with you, what kind of deliverables, what kind of impact we really want to see after 1 year? And what tools, importantly, do you need to hear from us? Right? Do you need different kinds of toolkits for designers to be able to use this to activate research and translation to practice? And with that, I'm going to turn it over to Whitney to talk about the recent webcast that she hosted with some wonderful speakers.
Thank you, Angela. So when we launched the Global Research Agenda, instead of being done with the report and putting on the shelf as researchers love to do, we actually believe this is the beginning of our work. And it's a humbling process for us to say, we don't know where this will go. We're going to put all of our energy into 12 impact topics that we think are timely and relevant, and we're going to roll those out over the next year. The report goes into much more detail around challenges, business case, leadership examples, stakeholders, and everything that we think is really critical as we look at the topic of health, well-being, the built environment, the research around it. But we began with climate change, a beautifully appropriate topic as we were celebrating Earth Day. And I would like to posit feeling, I hope, although very isolated and separated, in many ways more united about our mission moving forward. And so with that, we put our minds together to say, why now for climate change? What do we do in the research on this? How do we activate our community? That's the kind of key word for us, activation. And you are all out there in the virtual world, and we want to hear, what tools do you need when you go in front of your client? What research do you need at your fingertips? What big questions do you need direction answers to? So I hope I don't need to convince people why now anymore. I hope that never again do I have to give a presentation on healthy buildings where I have to convince people that this is important. But clearly, when it comes to climate change, the time is now more than ever in understanding the connection between climate change and human health. We have extreme weather conditions globally. We have heat waves, droughts, wildfires that are negatively affecting air quality, and seeing how buildings were not prepared for that. Winter storms in Europe, North America, highlighting water infrastructure and building infrastructure vulnerabilities, and the list goes on. So we think in particular designers play a role in the topic of climate change and human health because of the issue of resilience of buildings and the people in them, and the environmental impact of material selection. So we're going to get real specific around those target areas that we think in particular designers can help us lead on. And Dr. Chung will be leading the presentation on that. So as part of activating this climate change impact topic, we invited some friends, colleagues, and experts from around the world to join us on a recent webcast. Dr. Howard Frumpkin, Dr. Chris Pike, and Jennifer Toronto joined us. And I'll quote Dr. Frumpkin here on the next slide. So he really, for many of us, is a mentor that has led us in the direction of understanding the human health and climate change connection. And he really started off the webcast by saying that climate change is a huge threat to health. But he quickly turned to say it's also an opportunity. And I really want that message to be one about uniting these fields, the and not the or conversation, and really this beautiful space and time that I hope we do not have questions like, how do I look at an energy efficient building and in doing so sacrifice human health? And frankly, vice versa. We are very interconnected in planetary health issues, which is something that Dr. Frumpkin recently published a book on. For further examples of these connections, and it's a long list, is that when we look at climate change and human health, examples of the intersection include heat and health. So this extreme heat, extreme cold can affect, well, clearly kidney disease, early onset morbidity, reduced work performance. Severe weather events such as storms, cyclones, and tornadoes clearly can lead to acute injuries, but also have lasting disruptions of people's lives and mental health. Mental health is absolutely a climate change and human health issue. And then air quality. And we saw that really powerful connection when we were looking at particulate matters in New York City and the decrease and how that led to, they thought, a potential decrease in vulnerabilities around COVID infections. So a lot of these really important linkages on air quality, climate change, and human health. Jennifer Toronto joined the webcast, and I cite her here because she offers that case study example of a practitioner working on climate change and human health and battling issues around this every day. And she really followed the path of WELL to be the first WELL certified project in New York City with structure tone. And I think she's a Renaissance woman in so many ways. She wears so many hats, and I think she's a beautiful example of pulling in her leadership in sustainability, construction management, and human health to create a project that really is a pillar and an example of how we can balance the topics around energy efficiency and human health. So if you'd like to learn more about the International Well Building Institute's efforts on climate change, we put out an industry brief. This is meant to be a quick highlight of the current action on this topic, including a summary of the research, key research questions that our global advisors advised on. If you are a student out there or you're a professional really wanting to engage in this topic further, we listed university programs and advisors that you can direct your questions to if you'd like to learn more, or if you're interested in pursuing, we hope, a lifetime full of research and practice. These are great resources for you. And this next slide just shows you some additional content around what the WELL building standard is specifically doing, as well as crosswalks with all green building rating systems that WELL has undertaken. And then I'll also highlight our work with Enterprise Green Community Partners, really looking at the housing issue and at times housing crisis and bringing health into that conversation. We've deeply partnered with Enterprise, and it's really an exciting program. So with that, I want to put forward some of the key considerations as we're looking at research on climate change and human health. So interdisciplinary is really critical. This is a two-way street. It's not enough to do the research unless you hear from practitioners, did it work? Was it accessible? Was it affordable? Did we have the right language? Do we have the right way of communicating it? You know, we are challenged as we speak to even how marketing teams are looking at how they translate research to practice, is that we really need to be savvy and where is our client today, and meeting them there with where the research is. We think that applied research is critical here too. So again, out of the lab and into the office. We need diversified stakeholder needs, encouraging a lot of different people to come to the table, technology, HR, folks that speak different languages, but also have significant budgets that really need to be part of this conversation early on. And then we always encourage that business case side of it. It's always a moment for me, and I could probably speak here for Dr. Lowder, when we talk to clients about well buildings and they say, yes, I want to do this, and yes, I see the path for this, and yes, the client's interested, but what's the business case? And, you know, I'm really proud that we have a lot of resources to support that, but I can't encourage you enough that you're always thinking that direction when you approach the client. I don't think the hard part is convincing a client to have a healthy building. I think sometimes the harder part is being in their world around how did they translate this to their leadership to really be able to support this in action, right? And continue to support the research and translation. Great. And so with that, sort of a summary of our first quarter efforts on climate change, and now turning it over to Dr. Chung to really dive deeper into what ASID is doing in this space and application for our design community.
Thanks, Whitney. As Whitney had mentioned in the introduction, really gets into activating research. Angela did a great job in unpacking the global research agenda and identifying the 12 impact topics while going into the deep dive on climate change. But I want to address that, okay, so what does this mean for designers? How do we address this from the designer perspective, and how do we activate this from our side? So taking to account the global research agenda, really the questions posed on climate change all are applied to design. First, on resilient, restorative, and or regenerative design practices, connects design to occupant health. It connects the design to climate change. It connects it to building and human health as well. So really looking at this from a holistic perspective of how we're connected through people and planet, and how place can take a role on that. I wanted to add another research question here for designers, and really it's how do we activate research? How do we take research to action in the design projects as we see our role to continue to evolve through time? And what is our opportunity for leadership in this? As we get into finding solutions, as we are best posed to do as designers to problem solve, it gets into really first understanding what's the condition, what's the situation, what's the barriers that we have in front of us. The barriers really get into quite several, as we see in the next slide. But it gets into having lack of data. We're hungry for data. Our clients are hungry for data, and really understanding how design can make a difference. We face barriers on costs and financials. Again, really hungry for understanding data. And as Whitney had mentioned, creating the business case and being able to communicate that in a fashion that resonates to our clients. Expertise, technology as well. Other barriers that we see, especially, is when the designer enters into the conversation. We acknowledge that designers really are these connectors between the client and the design and the implementation of it. So how do we get into the conversation early on? How do we make sure that we can best connect all and activate all the strengths of the team in order to come to the best solution? And really for that, we need leadership. We need to lead that conversation. We need to identify and really activate each collaborator in all of this. So research is critical in design. Gary Wheeler, our CEO over at ASID, really understands this. And as we see the role of research, the need for research to help us in understanding the design solutions that can help us through this pandemic, to make sure that we're providing the best for clients. Research is critical for us to move forward on this. At ASID, we're very core to research and making sure that research leads to action. So as we take research to action, we have several resources that are available. One, research briefs, again, to make sure that designers have the research they need in order to practice design, whether that be on topics of chemistry, material health, understanding all these impact topics, which we've activated a task force in creating and making sure that we can cover various topics that are core to design practice. It's not only taking this research, and I love how Whitney identified that research, it shouldn't lie on a shelf, but really it needs to be activated, it needs to be used, it needs to be realized. And in order to do that, education plays a huge role. So education on these topics to really bring research to application is part of it. And then outcome of design program, which we'll send a link through the chat box. The outcome of design program, which we launched in the fall of 2018, really recognizes that in order to have this conversation about the value of design and the strength that design puts forth, needs to be measured. Research needs to be at the core of design. Evidence-based design has been part of practice for many, many years. It's to complete that loop. So evidence to design, and then design also generating evidence for future projects for continuous improvement, etc. So outcome of design really pushes that forward in understanding the importance of research in the design process and making sure that projects can become a tool for education, become a tool to learn further and to really advance the interior design profession. Some examples of outcome of design, this, although not part of the outcome of design program, is actually our ASID headquarter office, which is the world's first LEED Platinum and WELL Platinum space. And looking at the pre and post occupancy data to really demonstrate the impact that design has on occupant health, on engagement, also on the environment. So looking at it at various scales and making sure that we can communicate that out to not just within our community, but to also to others. We've been, at least pre-COVID, very fortunate to have many visitors come to the office to hear about the research and the design and really understand how those two are connected to each other. Other projects that we've been able to learn more about. So Studio IDS, which is a 2019 ASID Outcome of Design Award winner, really exemplifies how sustainability is part of the culture of not only the organization, but the community at large, and really embedding sustainability in all aspects of the design. Another example is the Lasan Studios over at University of Utah, also a 2019 award winner. And this project is a beautiful project, really understanding the building performance and its relationship to sustainability, but also because this is an environment that teaches sustainability to students, the next generation. They're using this as a tool to understanding building performance, to understanding sustainability and entrepreneurship behind sustainable practices as well. And then finally, another example is the Ed Moser Associates Living Lab over in New York City, a 2020 award winner. It's beautiful, not just aesthetically, but to understand that they're using their own environment to teach, to learn, and to grow in their practice. They've made changes over COVID to make sure that they adapt to the needs, the evolving needs, but also taking this as an opportunity to teach clients, to educate clients on really how design impacts lives, impacts the human experience, and through metrics, through actual measured outcomes. So these are some ways that research can lead into practice, but also practice generating to more research. We acknowledge that this isn't something that is to be done in silos, but there are collaboration and partnerships out there. We've been reaching out to the community to understand how research can be applied in design practice. And we reach out to you, to designers, to professionals, to understand what's really needed and how we can support resources for taking research to action. Finally, I wanted to mention Metropolis, as they have activated the Sustainability Hackathon. And really it's gathering interior design firms and product manufacturers, associations, clients together to really tackle several issues on sustainability and see how we can change the design process, but also change the design products, the actual projects as well. So very excited that this is a collective opportunity to really make change in this world. The role of design and designers really has been evolving. Whitney has mentioned this recognition of being trusted advisors. With that, as we continue to see that come forth, we also know that in the next slide that there are 3 core areas, especially for climate change, that we make a change. In that, it's indoor environmental quality. It's doing the best that we do in design, understanding this holistically, looking into the whole environment, considering the energy efficiency, looking at the design as it impacts occupant health, and really looking into materials. And as we look at this pandemic, really it's taking a fresh perspective and seeing that there is the need to make the invisible visible. So to understand that materials really matter, and in order to activate that is to have a better understanding about material health and being able to communicate that to the occupants who are using and experiencing the materials indoors. Another is material selection and specification. And with this, it's really getting into more specifically, holistically, looking at the life cycle, looking at the raw materials, understanding the manufacturing process, and also how it's being constructed or installed. Really, it's looking at the entire life, even after it's been used and it's disposed. Looking at this holistically, also understanding the timeline for the life of the product and how it's being used in consideration with leasing timelines. It's really understanding how we can make better selections, really understanding what information is needed, reaching out to our product manufacturers to understand better on what material information there is, having transparency, and really pushing the industry forward in getting this information so we can ensure the health and safety of the occupants we design for. And finally, it also gets into post-design, so maintenance. Design doesn't stop, right? Design continues to evolve, and really it's in order to activate the design for the end users. Education is crucial to CEOs and to the users as they experience the design. They need to understand the design itself, but also how to maintain it, how it has an impact on how they work, play, heal, learn in the space. Understanding the cleaning protocols and really educating on that to ensure that the material is being maintained in an appropriate way. Resilience to really extend this out and understand that situations change. How can the design adapt to those situations and really become the best support possible? There are many lessons from healthcare on this, especially in cleaning protocols and maintaining the space. And we have those tools and resources as we share across different space types. Really post-design gets into continuous improvement. So doing research even after the design project to understand, okay, what needs to be improved? How does that need to be improved? And continually having check-ins with the end users so they can best use the design as it was intended to be used, or to improve it as needs change over time. That gets into the concept of flexibility. So no longer having renovations repeat because the design didn't work, but making sure that within the design, it is flexible enough to adapt to the changes as we continue to experience different situations during the period of inhabitants. So with all of this, really gets into reimagining what design is and the role of designers. It's rethinking the role that we play. We're still the trusted advisor. It is about physical and psychological safety of the occupants, but it's expanding that out. So with post-design and educating CEOs and end users, it gets into the realm of change management, which we've been dabbling in as well, and continuing to expand within those areas. But it's also reimagining how does design play a role in roles of positions of chief sustainability officers, chief wellness officers. Beyond that, really, how do we activate culture within an organization? How do we have these conversations with the clients to really help them realize the culture that they have, and to use place to be a realization or a manifestation of that culture. So they're living within who they are in an actual physical environment. It gets into engaging with clients in a different way. How do we educate? How do we take the research and really address it to the appropriate audience? How do we take the design and also address it to those who really need to know how the design has come together in the physical space? And all of this comes to this piece of demonstrating the value of design. Design has the potential and the power to do so much. And with research, does it really activate that? Does it really create this tangibility, this visibility, and this measurable aspect of what's in front of us? It also becomes an opportunity to connect with the community. Expanding, it's not just my space, but it is that shared space. It is that shared community. So understanding from all points and making these connections is really how we're seeing the role of designers expand. So as we look towards a future of design, really, it gets into looking at people, place, and planet. It's looking at these at different scales. Understanding the people and really the work that designers do has an impact on physical and psychological safety. Considering the next generation, right? The future is about the next generation. How do we prepare, and how do we also design for them? The generations Z is really focused on the purpose of all, the purpose. They're about purpose-driven design. They're about understanding that everything comes together. They expect organizations to not just have a sustainability statement, but to really act that out through their work, through other practices, but also through their space. It is about creating this culture of health, and that could also lead into placemaking and actually activating places to be designed purposefully for the future. Really seeing this all together, that we're all connected, that we are a community, we are a network, we are an ecosystem, and understanding that the decisions, the actions that we take, even though it is an individual, it does have an impact to those that surround us, to this planet as well. So understanding this all together is really what we should be considering in the future of design. And with that, I'll pass it over to Angela to talk about other tools.
Thank you, Susan. So just to give you, as you know, Dr. Gray had said that we don't want this to sit on a shelf. We really want this to be activated, to know what kind of tools, how do we get this into the hands of designers? What can you use right now? So I'm going to talk about a couple of tools that you might be aware of or maybe not aware of, and some of the ways that IWBI is engaging with buildings, health, research, and climate change. So Teresa McGrath is on our research advisory, as well as Dr. Chung, and she leads research at the Healthy Building Network, who some of you may know about, and they do a lot of work on transparency around materials. They do a lot of research on what materials have the most impact, and they have quite a few tools, and really a lot of their tools involve looking at the materials with the most impact so that designers can make the best decisions, saying if you're going to have the most impact, these are the chemicals or materials of concern and chemicals of concern. So trying to really make that as approachable and as applicable as possible. They have a lot of relevant publications, for example, on materials and housing. They've done a lot of work on, for example, affordable housing, a lot of work on how to get materials into that space. They've got work as well in publications on integrating healthy materials into energy efficient programs and materials guide and resources informing action. So that is another publication. They have policy toolkits, a lot of work they do around policy. They have case studies. As I mentioned before, they've got a lot of work on affordable housing as an example of that translation to design. WELL also does quite a bit of work on activating research to the design. So for example, we have, of course, as you know, a whole concept on materials, and our concept feature XO7 really talks about promoting material transparency across building material and product supply chain. So an example of this is that for one of the parts of the feature, at least 50% by count, or 25 distinct permanently installed products, it includes a lot of variety of building products, needs to be disclosed. The ingredients need to be disclosed by the manufacturer, a disclosure organization, or a third party through one of the following. And of course, we have alliances with the Declare label, the Health Product Declaration, Cradle to Cradle, Product Lens, Health Product Declaration, and Manufacturer's Inventory. So this is one example of some of the ways that we translate that research to practice around materials and climate change. We also have crosswalks. So a lot of our projects, especially the ones that, showing leadership, they show leadership environmentally and with human health and well-being. So a lot of them pursue LEED or BREEAM or Green Star, depending on what country they're in, as well. And we have crosswalks that show, how close you are, if you pursue one of these standards, how close you are to be able to also pursue the second one. We also are working on investing for health. So one of the key things that came out of the research advisory that we've been working on is that we need to approach this from different angles. And one of those angles is investment, right? And the investors have told us, some of our research advisors have told us that they don't have the knowledge to even ask the right questions to be able to know how to invest in real estate portfolios that have healthier building practices. And so one of the things that came out of this, one of the barriers identified, was getting better information to investors. How do we look at those incentives and disincentives that currently exist around investing for health and healthy building practices? And this is one of our our programs called Investing for Health, in which we're trying to demonstrate materiality of health to a business's bottom line. Materiality means that it shows up in your sheet in terms of inputs and outputs, one of your costs, right? So it's not just a theoretical concept, which sometimes happens around things around health and well-being and around climate change. It's this abstract idea, but it doesn't show up in our balance sheet. The goal of this is to show that health shows up in your balance sheet. And this does this through performance. So showing that health impacts performance. Leading organizations are understanding that human health impacts corporate performance indicators, such as productivity, engagement, and resilience. It's particularly important as we are facing a return to work, back to the workforce, and we have a mental health crisis globally around returning to work because of COVID-19. We're showing health impacts, risk, and return. So movement to incorporate new data and reporting like environmental social governance, otherwise known as ESG factors, CSR reporting, that evaluate risk and return, and really showing that health needs to be part of that calculation, that health is being recognized as material to this bottom line, and that we can use health indicators to flesh out the social part of it, the S part. And lastly, that health brings a competitive advantage. We're really trying here to bridge the gap between investors, companies, and capital market influencers to really show that investing in the health of your people really brings you a competitive advantage. And we're working on a lot of different initiatives we can tell you about during the Q&A, but this is one of the key ways we're trying to really link traditional environmental reporting like ESG with health metrics. We also have a strong advocacy arm. Dr. Jason Hartke works on a lot of different bills. We're just giving you a quick snapshot of some of these. One of them is initiatives, memberships. So we are involved with the Build America's School Infrastructure, the BASIC Coalition. This is driving policies that invest in healthy and efficient upgrades to America's public schools. There's a whole list, and in fact, an article came out today that lists a whole bunch of these initiatives. So if you want more detail, we'll put that link in the chat. We're also involved at a municipal scale. So the city of Cincinnati, their 2030 district, contacted us and said, we really want to do a crosswalk with local public health data and the WELL building standard to highlight which features our 2030 district members can pursue that link key environmental reporting, energy and water here, as well as health indicators. So this is their health pillars that they just came out with, and they've been doing a lot of promotion on this activities and this initiative. We're really, really excited about it. Stay tuned for more information. At a federal level, we're supporting acts like the Climate Leadership and Environmental Action for Nature's Clean Future Act. And the goal of this one, as with many of these bills, is to establish a national goal to reduce emissions by 50% below 2005 levels by 2030, as well as to achieve 100% clean economy by 2050. That would be wonderful, through things like infrastructure strategies, improving efficiency of new and existing buildings. So again, these are all advocacy work that needs data. It needs research, it needs case studies, but it really links climate change and health. So just to close up here, we've talked a lot about the opportunity for leadership from designers on climate change, and particularly now. We've got such extreme weather events. We've got a public health crisis. We're having to go back into buildings. Now is the time. So this really, we're hoping, is a call to action on research and practice for designers. And we really want to focus that sometimes climate change can seem really overwhelming. The headlines are really depressing. It's this global action. What on earth could we possibly do to have an impact? And I think an opportunity for hope and for change here is that the most action we've seen has been local. Local, the climate change action, local climate change mitigation and adaptation practices. And what we'd like to see is merging this building level practice, as Susan talked about, with that local and community level practice. This, we feel, is going to be a real nexus for hope, for optimism and change. Examples of this are linking this sense of place that can be created in that building with initiatives like the 15-minute neighborhood, resilient and regenerative communities, linking biophilic design in the buildings and restorative spaces in buildings with regenerative city policies. We feel like now is the time to be able to make those connections between research, building level design, and practice, as well as climate change initiatives.
Great.
And if you want to download the Global Research Agenda, we have a link there in the chat. We'd love to have hear your thoughts on it. If you know about any policies, any research, any initiatives that you think would relate to any of the impact topics, not just climate change, on the Global Research Agenda, we would love to hear from you. Please let us know. And with that, we're going to open it up to Q&A.
Perfect. Gotta get the slide in there about downloading the Global Research Agenda. That's so important. Please do download that. So a lot of great questions are coming in from our esteemed virtual community. So I think we'll just dig in and get started. I really appreciate that a lot of these questions, I think, are around, what do designers need to be educated on this topic? Where do they go for more information? So let's provide some great answers here. So let's start with, how do designers access the research on climate change and human health to engage their clients? Susan, do you want to start with that and then I can follow?
Sure. Well, you're in the right place, right? Because this session just went through a plethora of resources to really talk about climate change and human health. IWBI has many great resources on their website that really look into climate change and other topics connected to people and planet. ASID as well. In our research, we don't currently have anything specific to climate change, but we are actually working on a few resources that should be out within the month to really talk about how climate change relates to interior design and how designers can really take the research to not only educate themselves, but to this attendee's question, to really engage with clients, to make sure that there is that tight business case and can hit those high level key points that are relevant to the CEO. I'll stop there. Whitney?
Sure, yeah, I can add to that. So throughout the presentation today, we've included links in the chat. So that's a great place to start. So just let's go through those quickly. The Global Research Agenda is downloadable on wellcertified.com. We have the webcast currently that you can download on climate change, human health, and built environment with Dr. Howie Frumkin, Dr. Chris Pike, and Jennifer Toronto. Those are leaders and experts, each of which have follow-up information, books that they've published, case studies. So we really believe at IWBI that our goal is to connect you with these experts in the field and also to support our experts to continue to do this research. We have an impact topic brief. So that's a 2-pager that you can send along to clients. You can say, yes, I'm a designer, but I'm a public health advocate. We're leading these issues, and planetary health, by definition, includes human health. So here's what we're up to. And I also say stay tuned. I think this conversation is really burgeoning. Yes, we focus on materials, and today you can go to wellcertified.com. You can go to our research digest. You can download specific research that supports the material transparency, for example. You can look at all the partners that we bring in. You can look at the step-by-step guide of working with clients. You can see how we test performance on site. But there's actually, I think, these bigger conversations at play that Dr. Lowder started referencing, which is, how do we get local? What is happening right now with our connection to our local community? Where climate change has, I think, all too often been a global conversation. But right now we're so connected to our neighbors, to our, to the forest, to the nature outside of our window, or at times lack thereof. We're connected to the workers that are, potentially in the building, design, construction space that may be exposed. We're looking at pollution issue and breathability in cities. Like, there's a very powerful conversation at play right now around pushing climate change, I think, topics into the lens of, I want to say post-pandemic, but I'll just say pandemic lens, and hope for post-pandemic soon. So I think that's really where we don't have the answers, but we really have, I think, the opportunity. I think I'll just leave you with the note on sick building syndrome. I think for human health researchers, we learned, unfortunately, that some early pushes in the 1970s, post-OPEC oil crisis, focus on tightening the building. And it was really the first time we saw this emergence of these 10 symptoms that displayed and dissipated when you left the building, called sick building syndrome. And this idea that you promote, climate change issues while at the same time not thinking about the human health issues is a lesson we learned in a very hard way. And I see shadows of it right now when we're talking about the pandemic and cleaning practices and lack of ventilation and toxic chemicals. And this idea that if it's clean, you're safe. And I think for many experts in the line, we realized certain materials were not meant to be exposed to those cleaning products. We see them being used and not ventilated. So there is a big conversation to help people understand these interconnections. And I think COVID has brought a new lens to it. I will pause there and jump into the next question. Let's see here. So this is anonymous, wrote in, I'm a designer interested in learning as much as I can about health, well-being, and climate change. So we're glad you're here. But they're having a hard time finding research that's approachable and understandable. I wouldn't even know the right questions to ask if I did, but I want to learn from credible, relevant sources that are at the forefront of this work. What are your top 3 recommendations on how to enter the research space for the average person? Thank you so much. Who wants to take that?
I can mention 1 or 2 things from IWBI, but I would love to hear from Susan as well, because I know designers have specific needs. They often like cookbooks and like toolkits. As Whitney had mentioned, we have those research digests. So I understand marketing it's really hard to understand what is credible, what's not. So IWBI, one of the advantages is that we're agnostic. We don't promote one product over another. We can't, right? That would invalidate what we're doing. And so the concept and feature backgrounds has a whole bunch of information for you. And we've also heard that that's not quite enough. So that's why we have those research digests. And Whitney's mentioned those research digests. Those are meant to be, you could print them up if you wanted. They're background information. You can pull anything you want from them. They're free to download. That if, for example, you're with a client and they just don't think that, like, I don't really believe this air quality thing. Not really. You can pull this out and say, actually, there's this study, there's this study, there's this study. And they're put into different formats. So this is the health impacts, this is the design impacts, this is the building impacts. So that's an easy tool for you to be able to use. Anything that's not product specific, and that cites particularly journal articles. Those are great sources of information. That is a good place to start if for it to have credible information. And Whitney, Susan, I know you've got some input on what is maybe a little more accessible for designers in the language they need to see.
Mm-hmm. Sure. We acknowledge that really designers, they handle a lot. They're doing research, they're doing design, they're working with clients. They're really this connector piece and really need to understand so many different disciplines at once. And with acknowledging that, it really gets into, okay, how can we provide resources that are easily digestible? Similar to what IWBI is doing, ASID as well. We're in this process of making sure that the resources that we review are credible, that they're validated, they're reliable resources. I mentioned the Impact Task Force. Their task was actually to vet those resources from this process which they created called CRIT. It really gets into the critical, the reliable, the innovative, yet the trustworthy resources. And for us, it's to make sure that we bring those together, create summaries that are easy to read, easy to apply, and make sure that there are best practices coming from them. I'll say that these particular impact briefs are not available yet, but they are available soon. The other part to it is we do have other resources, topic summaries, and also briefs that we implement the same practice. So I would say similar, it's making sure that we can provide those resources that look to the peer-reviewed journals that have been vetted already, but just need that translation piece so it's easier to really digest, to decipher, and to be able to apply it to research is our focus. And I do believe that many design firms, design associations have been implementing that practice as well.
Great, thank you, Susan. So I love this audience. We're getting such great questions. So please do consider this the beginning of the conversation with all the speakers today, and reach out on LinkedIn, and we'll do our best to continue this dialogue, of course, with our great partners at NeoCon. Maybe we'll round out the conversation with the last question, and I'll kind of start with some comments here about how has research itself and educating the industry on research changed since COVID? So I think one of the major messages that I want to put out, to this audience is, we have to move away from explaining why healthy buildings. We are now in the how conversation. If you are not educated and informed as a designer right now around strategies of health that you can bring into your work, you need to get on top of this, right? You need to be able to inform the client, what are they doing for ventilation, filtration, and cleaning practices? What are they thinking about when it comes to energy efficiency and circadian lighting? How are they looking at providing psychologically safe and physically safe environments for clients to return? And I would go as far as to say that this would be a missed opportunity not to be educated and bring it to your client. Even if they're not today able to walk down the path of well, that does not mean that you cannot inform them, download these resources, and be their trusted advisor as they take a step forward to understanding this path. It's an expectation with the leading design firms that you do have this knowledge. And further, I do think that designers should be paid for that. I think that they, as an industry, should be recognized for this knowledge. And if you are the trusted advisor providing health information for your client, I think that needs to be recognized. We're seeing the consulting firms stepping up. We're seeing new players in this space that are trying to kind of get in there to help direct clients as to what's the best product, what's the best service. And it's a crowded space that we have a lot of folks that do not have credibility that are in that space. And that leads to client overwhelm. That leads to what's the newest fangled gadget. And I can't tell you how many leaders have said to me, and design leaders, it's not like we didn't know this, right? We're just finally being asked in a way that we can actually convey it to our client. A lot of our healthcare leaders in design have long understood around viral spread, pathogen load, issues around material safety. And so I think this is just a really powerful time to be educated, to be paid, to direct clients, to drive the industry, to to really increase the next generation of design professionals into this. And to make sure that you come with credible information. That's the research. Research does not say we figured it out. It says this is the best information that we have today. And we want you to have the information so that you can make the decisions that are best for you and your client, and we will continue to commit to doing that. So I just want to thank, I'm seeing Kim has written in, which was great, Rebecca, Bernadette, Susan, thank you all for these great questions. I just want to acknowledge all that and thank my incredible and illustrious co-speakers, friends and colleagues for your commitment to this work and just a space to share today on Earth Day with our virtual community. And I think with that, we'll turn it over to the NeoCon team for some final words.
Thank you, Whitney, and thank you so much for joining us today. Thank you, Dr. Chung, Dr. Lowder, Dr. Gray, for a very informative and very important discussion and presentation. We appreciate you being with us. This presentation will be posted onto the NeoCon program library on neocon.com. So if you want to watch again or share with any of your colleagues, you can do that. And I know there were a lot of links and resources put into the chat today, but I think if we want to put those together, we can send an email with some of those to the attendees after this presentation. So thank you so much again. Very interesting, very important information, and we hope you all have a great day. Thanks.
Thanks, everybody.
Thank you.
Thanks, everyone. Be well.